Have you ever felt the world spinning for no apparent reason? That dizziness that makes you feel unsafe, even getting out of bed? If you're over 45 and dealing with this problem, you need to pay close attention to what I'm about to reveal. Many people believe that all dizziness is just labyrinthitis and end up ignoring important signals their body is sending. What's most surprising is that the first sign on this list is frequently mistaken for simple discomfort, but it can indicate something much more serious that needs immediate medical attention. According to Mayo Clinic data, about 40% of people over 40 will experience some type of significant dizziness during their lifetime. As a specialist physician in vestibular disorders for over 18 years, I've treated thousands of patients who delayed seeking help because they believed their symptoms were just labyrinthitis or something that comes with age. This is a dangerous confusion. Today I'm going to share with you the 7 warning signs that indicate your dizziness. Might be something beyond a simple inner ear disorder. It's crucial to know how to distinguish when to seek immediate help and when conventional labyrinthitis treatment is sufficient. Let's start with the 7th sign, which, although less alarming than the others, already deserves your full attention. 7th sign, dizziness with intense anxiety. The 7th sign that indicates your dizziness isn't just labyrinthitis, is when it comes accompanied by intense feelings of anxiety, as if something terrible is about to happen. Many less experienced doctors might attribute this dizziness simply to an anxiety disorder, but the relationship might be exactly the opposite. Rosa, 68 years old, a retired nurse, came to see me after 3 months suffering from episodes of dizziness that her previous doctors had diagnosed as purely psychological. Doctor, they referred me to therapy and prescribed anti-anxiety medication, but something told me it wasn't just that. The dizziness came first. The anxiety came after. As a consequence of the constant fear of feeling sick in public, she reported during our first consultation, after detailed examinations, we discovered that Rosa suffered from a condition called vestibular migraine, which is frequently misdiagnosed as anxiety or common labyrinth. This condition affects the vestibular system through mechanisms similar to traditional migraines, but instead of intense headache, the main symptom is dizziness. The most fascinating aspect of vestibular migraine is how it silently activates the same brain circuits related to anxiety, creating a vicious cycle where the patient actually develops secondary anxiety. To identify if your dizziness with anxiety might be vestibular migraine, observe if there are patterns in the episodes. Do they worsen with certain foods, with hormonal changes, with sleep deprivation? This pattern is a powerful clue. It's important to understand that treating only the anxiety in these cases is like trying to dry the floor while the faucet continues running. You need to address the root cause. Rosa started a combined treatment that included preventive migraine medications and vestibular rehabilitation techniques. Doctor, after so long being treated as if the problem was in my head, it was a relief to discover there was a physical explanation for what I felt. In 3 weeks, I already noticed significant improvement, she shared at her follow-up visit. If you feel dizziness accompanied by intense anxiety, don't allow doctors to dismiss your symptoms as just psychological without first investigating physical causes like vestibular migraine. Now, let's move to the 6th sign that indicates something beyond common labyrinthitis. 6th sign, dizziness when standing up. The 6th sign that deserves attention is dizziness that occurs exclusively when standing up, especially if accompanied by vision darkening or a feeling of imminent fainting. Although many associate this symptom with low blood pressure or a sudden movement, it can indicate more serious conditions that affect cerebral circulation. Joe, 65 years old, a former bus driver, came to my office after a frightening episode. Doctor, I was sitting watching television, got up to answer the phone, and suddenly the world went dark. I felt like the floor disappeared under my feet. I managed to lean on the couch in time, but I was afraid of having a stroke, he told me, visibly shaken. After a complete evaluation, we identified that Joe suffered from orthostatic hypotension, an abrupt drop in blood pressure when changing position. However, what many people don't know is that this condition can be a warning sign for more serious problems, like early heart failure or even certain types of atypical Parkinsonism, where the autonomic nervous system begins to fail. The difference between simple postural dizziness and a warning sign lies in the intensity and frequency of episodes. If you need to hold on to furniture to avoid falling every time you stand up, this isn't normal, regardless of your age. The human brain is surprisingly adaptable and has compensatory mechanisms that normally adjust blood flow in milliseconds when we change position. When these mechanisms repeatedly fail, it's as if your body's internal GPS has a serious system malfunction. For Joe, we started a protocol that included controlled hydration, adjustment of medications that could be contributing to the problem, and specific exercises to improve vascular response. The doctor taught me to stand up in 2 stages. First, sit on the edge of the bed for 30 seconds, then stand up slowly. This changed my life. I'm no longer afraid to answer the phone or go to the bathroom during the night, he reported at his 6-week follow-up consultation. If you identify this pattern of dizziness when standing up, especially if you're taking blood pressure or heart medications, a detailed medical evaluation is essential to rule out more serious complications. Let's now move to the 5th sign that indicates your dizziness goes beyond simple libido. 5th sign, constant, persistent dizziness. The 5th concerning sign is constant dizziness that simply won't go away. That which remains for weeks or months without clear periods of improvement. Traditional labyrinthitis, even in more severe cases, tends to show fluctuations, moments of worsening, followed by periods of relief. Anna, 72 years old, grandmother of 5 grandchildren, came to my office after suffering uninterrupted dizziness for almost 3 months. Doctor, it's like I'm permanently on a boat. I don't have a minute of peace. I've tried all the labyrinthitis remedies they prescribed, but nothing works. I'm starting to think I'll live like this for the rest of my life, she confessed, with tears in her eyes. Anna's case immediately caught my attention. Constant dizziness without periods of improvement. And resistant to conventional labyrinthitis treatments frequently indicates a condition called persistent BPPV, atypical benign paroxysmal positional vertigo, or, in more concerning cases, a paralymphatic fistula, a small rupture in the inner ear membranes that causes fluid leakage. But what we actually discovered after detailed investigation was something completely different. Anna suffered from a rare condition known as superior semicircular canal dehiscente. In this condition, there occurs a thinning or abnormal opening in the bone that protects one of the balance canals of the inner ear. It's as if the protective roof of your balance system had a small hole, leaving the system extremely sensitive. Any louder sound or pressure change would trigger intense dizziness in her. The worst is when my grandchildren scream or when the dog barks. I feel like I'm falling, Anna explained. This condition doesn't respond to conventional labyrinthitis treatments because the cause is structural. In her case, delicate surgical treatment was necessary to correct the problem. After so long thinking I was doomed, the doctor gave me hope again. After surgery, it was like someone finally turned off the dizziness button that was stuck on. Anna reported 3 months after the procedure, dizziness that never gives relief is a red flag that requires specialized investigation, often with advanced imaging tests that aren't ordered in common labyrinthitis cases. Now, let's move to the 4th sign that indicates your dizziness might be something more serious. 4th sign, dizziness with vision changes. The 4th sign that should trigger an immediate alert is when dizziness comes accompanied by vision changes, such as double vision, blurred vision, or temporary vision loss. Carlos, 61 years old, a construction materials salesman, came to see me after a particularly frightening episode. Doctor, I was driving when suddenly I felt like the world started spinning. I tried to focus on the road, but my vision became blurred, and for a few seconds I saw everything double. I managed to pull over to the shoulder, but I was terrified, he reported, still visibly shaken by the experience. The combination of dizziness with visual disturbances might seem like just an intense symptom of labyrinth, but in reality it can be indicative of much more serious problems, such as vertebrobacillar ischemia, a temporary reduction in blood flow to the posterior part of the brain, where the balance and vision control centers are located. This condition is particularly concerning because it can be a precursor to a stroke. Our balance system is surprisingly complex and depends on perfect integration between the vestibular system in our ear, vision, and proprioceptus position sensors in joints and muscles. When the brain detects a conflict between these systems, dizziness emerges as a warning signal. In Carlos's case, we performed a series of tests that revealed stenosis narrowing in one of the vertebral arteries, which supplied blood to the brain. This narrowing was causing transient ischemic episodes during certain neck movement. It's as if your brain's GPS was temporarily losing signal due to a power failure. Carlos's treatment included medication to improve cerebral circulation and prevent clot formation, plus guidance to avoid extreme neck positions. The doctor explained to me that what I had was definitely not labyrinthitis. If I had continued taking labyrinthitis medication, I could have had a complete stroke. Now, I understand the importance of not ignoring these symptoms, Carlos commented at his follow-up consultation. If you've experienced dizziness accompanied by visual changes, especially if brief but intense, don't hesitate to seek emergency care. This could literally be a life or death symptom that no labyrinthitis medication will resolve. Let's now move to the third sign that deserves your full attention. Third sign: dizziness with changing tinnitus and hearing loss. The third sign that indicates your dizziness isn't simple labyrinthitis is when it comes accompanied by ear ringing that changes in intensity, especially if you notice progressive hearing loss in the same ear. Pedro, 55 years old, a businessman in the technology sector, came to see me after months of intermittent dizziness, increasing tinnitus, and hearing loss in his left ear. Doctor, at first I thought it was stress or labyrinthitis. I took the traditional medications, but the ringing only got worse. And I started to notice I wasn't hearing people well when they spoke from my left side, he explained. This specific combination of symptoms, dizziness, and unilateral hearing loss forms a classic triad that can indicate a condition called Meniere's disease. However, these same symptoms can also be the first sign of an acoustic neuroma, a benign tumor that grows on the nerve responsible for hearing and balance. The difference between labyrinthitis and these more serious conditions lies in the progressive pattern of symptoms. In common labyrinthitis, tinnitus and hearing loss, when present, tend to improve as inflammation decreases. In more serious conditions, there's consistent worsening over time. In Pedro's case, the MRI revealed a small acoustic neuroma pressing on his vestibulocochlear nerve. I was shocked when the doctor showed me the image. There was something growing inside my head, and I was just taking labyrinthitis medication, he said, still processing the news. The good news is that, when diagnosed early, these tumors have excellent prognosis. Pedro opted for radiosurgery treatment, which stopped the tumor's growth without need for invasive surgery. The doctor explained to me that if I had ignored the symptoms longer, treatment options would have been much more limited and risky. Today, 6 months later, the tinnitus has decreased significantly and the dizziness has almost completely disappeared. He reported at his follow-up ear ringing, especially when accompanied by hearing loss on the same side in episodes of dizziness, should never be considered normal or simply treated as labyrinthitis without appropriate investigation by a specialist. This trio of symptoms is like an alarm your body is sounding, asking for immediate attention. Let's now move to the second most important sign on this list. Second sign: dizziness with severe nausea and uncontrollable vomiting. The second sign that indicates something potentially more serious than labyrinthitis is when dizziness comes accompanied by intense nausea and uncontrollable vomiting, especially if these episodes last more than 24 hours or become recurrent without a clear pattern. Lucia, 63 years old, a housewife, arrived at the emergency room with an alarming condition. Doctor, I started with mild dizziness yesterday, but in the last few hours it got so bad that I can't even lift my head from the pillow without vomiting. I've never felt anything like this before, she described, visibly debilitated. Although nausea and vomiting can accompany severe cases of labyrinth, the intensity and duration of these symptoms can indicate much more serious neurological conditions, such as cerebrovasculitis, where there's inflammation of cerebral blood vessels, or even cerebral hemorrhages. In Lucia's case, the CT scan revealed something no one expected: a small hemorrhage in the cerebellum, the part of the brain responsible for balance. This condition, if not treated quickly, can be fatal. The cerebellum functions as the body's balance processing center, receiving information from the inner ear, eyes, and position sensors and joints. When there's bleeding in this region, it's as if the body's navigation system goes into complete failure, resulting in extreme dizziness and uncontrollable nausea. Lucia needed to be hospitalized immediately and received intensive treatment to control intracranial pressure and prevent complications. The doctor explained to me that if I had stayed home, taking labyrinthitis medication as I initially thought of doing, I might not be here to tell the story, she shared, already recovered 3 months after the incident. What seemed to be a simple, strong dizziness was actually a medical emergency. The crucial lesson here is that dizziness, accompanied by intense nausea and vomiting, especially if you've never had diagnosed labyrinthitis before, or if symptoms are much more severe than previous episodes, should be considered a medical emergency until proven otherwise. Don't try to simply tough it out or treat at home. This is a case where every minute can make a difference in the final outcome. And now, we come to the first and most important warning sign on this list, the one that should never be ignored. First sign: dizziness with neurological changes. And finally, the first sign, the most alarming of all, That indicates your dizziness is definitely not just labyrinthal. When it comes accompanied by any neurological change such as sudden weakness on one side of the body, difficulty articulating words, mental confusion, or altered level of consciousness. Roberto, 70 years old, a retired physician, was at home when he felt sudden dizziness different from anything he had ever experienced. Doctor, as a physician, I knew something was very wrong. Besides the dizziness, I noticed my right hand was strangely weak and I had difficulty calling my wife. The words simply wouldn't come out correctly, he reported. Roberto had the presence of mind to ask his wife to call an ambulance immediately, a decision that probably saved his life. At the hospital, he was diagnosed with an ischemic stroke in the brainstem region, the part of the brain where motor control pathways cross and where part of the vestibular system is located. This region is so vital that it's often called the crossroads of the brain. When a stroke occurs in this area, symptoms can mimic severe but with additional neurological signs that are the true key to correct diagnoses. Thanks to rapid care and initiation of thrombolytic treatment medication to dissolve clots within the crucial therapeutic window of 4.5 hours, Roberto had an extraordinarily good recovery. The doctor explained to me that many people confuse the first signs of a stroke with especially when dizziness is the predominant symptom. If I had ignored the other neurological signs or tried to treat at home like I would probably have permanent sequelae or worse, he reflected during his rehabilitation. It's absolutely crucial to understand that dizziness, when accompanied by any neurological deficit, even if subtle like slight difficulty articulating some words or a tingling sensation on one side of the face, represents a medical emergency and should be treated as such. Summary and conclusion after reviewing these 7 warning signs. I hope you have a clearer understanding of when dizziness might be something beyond common labyrinth. Let's recap. Dizziness with intense anxiety may indicate vestibular migraine. Dizziness when standing up may signal cardiac or neurological problems. Constant dizziness without periods of improvement may indicate structural conditions of the inner ear. Dizziness with visual changes may be a sign of cerebral vascular insufficiency. Dizziness with progressive tinnitus and hearing loss may indicate tumors like acoustic neuroma. Dizziness with uncontrollable nausea and vomiting may be a symptom of cerebellar hemorrhages. And finally, dizziness with any neurological deficit may be a manifestation of an ongoing stroke. Knowing these signs can literally save your life or the life of someone you love. Which of these signs caught your attention the most? Have you ever experienced any of them and confused it with common labyrinth? Share in the comments your experience. Your story might help other people recognize these important signs. If this video was useful to you, don't forget to leave your like and subscribe to the channel for more health content that can make a difference in your life. Remember that health knowledge is power. The power to make informed decisions about your well-being and to know when to seek help. As I always tell my patients, listen to your body. It rarely lies. And when it comes to dizziness, knowing the difference between what's common and what's concerning can be the difference between simple treatment and serious consequences. Until the next video.